an obstetrician and gynecologist, so she actually has the best of both worlds. She has the surgical world and she has the primary care world at the same time. So we're going to get things loaded in the computer, but I want to ask a question. How many people have taken the old MCAT? Not you. How many people are getting ready to take the new MCAT or taking the new MCAT? Okay, so there was a reason that there's a new MCAT, right? So now there's a new behavioral portion of the exam and sociology portion of the exam, and there's a reason for that. Okay, the reason for that is somebody who sits up in their ivory tower, okay, has decided that medical school curriculum isn't what it should be, okay, because as we start to deal with population health, I'm involved in a pilot study at the Indiana University School of Medicine where we're teaching a new aspect. It used to be foundational science, and then it was the clinical sciences. Well, now we've added quality healthcare delivery science. You're going to learn about population health. So the reminder I want to give you, and I'm going to show you something at the end when we're all done during the question and answer period, is remember that when you apply to medical school, that the paradigm in medical education is changing. And they want to know that you understand that it's changing. Because if you don't understand it, your interview is not going to go so well. Okay? So you will get asked questions about it. All right? Okay. So, are we going to?
Computer is very slow.
Typically you'll go. But I think one of the things is that we get the general theme that we all love it here, and we still love it here, and that's part of the reason that we're back to speak to you, is that we still feel connected in one way or another. And hopefully someday, once we really establish this mentor program, you'll be able to come back and do the same thing for the students that will be sitting there, and you'll be up here. So anyway, Dr. Tamara Helfer, she's an obstetrician gynecologist, also with Christie Clinic, sorry.
No, we are all a happy family. So.
Okay.
Yeah.
Thank you very much.
All right, as you said, my name is Tamara Helfer. First, I didn't really get to know who all was in the room since I came late, because I was in office until 5. So just tell me, med students, all of you guys.
Undergrad.
First, undergrads. Okay, what year? Who are third years or juniors? Okay, who are seniors? All right. How many of you guys have thought you were going to go to med school since you were a baby? Okay, so some of you guys. How many of you guys just decided like a month ago? Okay. Well, more recently. Okay. So a few of you guys, the rest of you guys are in the middle. So you've had time to think about this and kind of decide what you wanted to do and come up with your own plans, right? I don't see, okay. Yes, I see movement of heads. Very good. All right. Well, to talk about myself, so I didn't follow do that for a physician not to do that. That's never heard of. So what I did is I can tell my story in about 5 minutes because I'm pretty boring. Basically, Tamara Helfer, I'm married to a urologist. I'm an OBGYN. We have 4 boys. Not sad. Good. I did go and get my MBA and my MD joint degree here at U of I. My husband got into SIU and transferred to U of I so we could be together. We got married when we were in medical school. We knew each other from high school, but we didn't start dating until college. Got married in medical school, and then started having kids in our residency. Obviously, you know urology, which you might not know yet, but urology is an early match. So my husband knew he had gotten like 6 or 7 offers or places to go interview, and then he had to put those in rank and file. Well, they match first, and then guess what? I match after that. And that's called an early match and a regular match. Urology is a hard one to get into, so obviously they do an early match, so because a lot of them don't get in, they can do the later or the regular match. My husband got into the University of Missouri. I was actually in Africa on a rotation, and he calls me to tell me, hey, this is where you didn't get in. I was like, it's $3 a minute. Just tell me where I'm going. Stop it. And so we basically went to the same place, which is University of Missouri. And both of us loved it. It was awesome. We had a wonderful time. Yes, I'm orange and blue first, and then I'm black and gold. So I do Big 10 and Big 12. We are big fans of football and basketball. With that said, we had 2 kids in residency. I then did 2 years of practice down in Missouri. Because urology takes 6 years, OB only takes 4. You know, for some reason, they take a little longer to learn their stuff. But don't tell myself that. But anyways, it took him 6 years, and our program's only 4 years. So I did 2 years down there, then we decided to move back here to be with family. We interviewed at both places. I went with Christie. My husband went with Christie. We just liked the way it felt. I work 3 days a week, and then I do assistant medical director stuff the other 2 days. So I do kind of multiple hats there at the clinic. That way I can use also my MBA. So that is me in a nutshell. Also, I do a lot of stuff with ACOG. I have a national position with ACOG, so I think that was more stressful than my oral boards. Sitting up there in front of 150 people talking for 5 minutes, being asked questions like directly at me, and you need to answer right now and don't even think. That was a little more shaky because you didn't have time to really study, and it was in front of 150 of your closest colleagues who write the books and do all that fun stuff. So I was more intimidating, but I made it through, got the position, and now I hold a national position with ACOG, which ACOG is Obstetrics and Gynecology. It's American College of Obstetrics and Gynecology. So that's enough. Any questions? All right. Okay, to go on, what I really want to talk about is your future in medicine. You can learn a lot about us, but you probably have already kind of decided what you guys have kind of started your path and where you're going. So I like to look back and see what I saw when I was growing up, and then kind of see where the future of medicine is going and where you guys might end up. So if you look here, if you think about physicians or doctors, what did you first think about? Norman Rockwell, right? That's what I thought of when I was growing up. You know, you have this nice, lovely guy in this uniform, this little outfit, and he always has either some sort of white. Is this one?
Yes.
Okay.
Well, it's a microphone.
Oh, it's microphone. Okay. Has this nice white coat on, or has this, done up to the T, and he has this little black bag, right? That's what I always thought a physician was. And then, we always know this oath, right? All of us take this oath. No, not so much. This oath really isn't used anymore. It actually says that you can't do abortions, you can't use a knife, so you couldn't do surgery. So for us, we would never really take this oath because it's actually also going to gods, which I don't believe in, like Apollo and other ones, and multiple gods that I don't even know about. So we really don't do that oath again, even though people always say, oh, you physicians take that oath. No. Now, what do we see in doctors today? This is what we see, right? People on TV think, oh, doctors are like House. Yeah, you have to be like House. You know everything. You're going to fix me. I'm an OB/GYN, and I get calls all the time from my mother-in-law's family members saying, hey, my ankle hurts. What should I do? Go see an orthopedic? Go see your internal medicine doctor? I don't know. Are you peeing okay? Does your vagina work? We're good. I'm out. So we are very specialized in what we do. Physician, but even like Cleveland Clinic was trying to out them because of the fact that he is this persona that's kind of more than what physicians of today kind of see ourselves being. Going outside the practice of medicine where they felt comfortable or in his area. So you can take that or leave it. Those are different options that you have. You can be a movie star doctor, or you can be like Dr. Oz. Other ones, how many of you guys have seen these? All right, how many of you think Grey's Anatomy is exactly how it is? Right? Oh yeah, exactly. Yeah, that's how it is. On the top, does anyone know what the doctors are? How many of you guys think that's a movie show? How many of you guys think it's a real doctors? How many of you guys think it's people who play doctors on TV? How many of you guys don't know, so they're not saying? They're actually true doctors. They have a talk show, and so they do talking and like public appearances and stuff like that. But how could you tell the difference? Both of these, that is what people today see. That is what your patients see. That is the persona that's out there. So when you go out and say, I want to do medicine and this and that, this is the sort of thing they're thinking of. This is how they perceive you. And so that is the sort of thing you have to come about and see. This is the perception. You're put in this box, this is how they see you as wanting to become and be. Doesn't mean that's how you have to be. Now, do you think these are real surgeons? Yeah, they are. It kind of sets it up there for you. Exactly. This is a campaign, and it's hashtag I am And it's the I am, you always see these, I am an African, I am a surgeon, I am an OBGYN. So these are all out there trying to show people this is truly what we are. It kind of was a campaign for women too, because a lot of people forget that physicians are women. And I like this one because I'm a woman, and we have a lot of women in the OBGYN, and people kind of forget that we are physicians. I walk in the room all the time, and the first thing they say is, oh, nurse, can you help me with this? I have a really bad period, and I need this pad. I'll get the nurse for you. You know, no, I usually take care of it, but they don't. They don't. Today's society still thinks women are, guess what, nurses, okay? Men, we have an awesome labor and delivery nurse. Oh my gosh, Jared is awesome. All the women love him. He does a great job. When we first hired him, everyone's like, a man in labor and delivery, what's going wrong? He gets the best reviews. He gets the best points because guess what? He says, I have to try even harder because I am a man. And people think, oh, this is a man. He does a fabulous job. I am so glad that happened. So people are different, and we have to perceive that and see it. And physicians are too. And so when you go out there, there's this perception that I want you to know about. People will perceive you, will already make ideas. You know, you guys in the first 10 seconds already decided about each one of us how you felt. Not because you wanted to, but that's just human nature. They've shown it, okay? All right. This is the modern oath, which I still don't think is always correct for what you guys' future will see. But this is the modern oath. This is kind of what you do today when you go out there and graduate from medical school. You will say this, you know. We don't say it after residency, but we do after medical school. What does the future hold for you guys? How many of you guys remember, I think you guys still remember maybe before there were cell phones? Yeah, maybe? Uh-huh. That's the boomlet generation who's like, I think 17 is the highest for that. So, you guys remember before cell phones? Maybe when you were like in your diapers? It's hard to remember a time without technology is what I'm saying. And with that said, technology is going to be your friend. We've already seen it started creeping into medicine. How many of you guys know what a Da Vinci is? How many of you guys have heard of Da Vinci? Okay. How many of you guys think it's just a painter? How many of you guys think it helps you in the office? How many of you guys think it helps you in the operating room? Very good. Yay! Okay. You are correct. I use this all the time. It's a Da Vinci. As he said, I do surgery and I do primary care. So Da Vinci, technology, never even thought before I was in residency. Went through residency, never even thought. This idea that you have to continually learn, definitely correct. You have to continually learn. You have to continually get your skills and figure out what you're going to be feeling comfortable with and what not. Trust me, there's certain things I do, there's certain things I don't do. You know, today I saw a 7-year-old and I said, I keep getting these pediatric gynecology cases because I don't want to. And they're like, because you're the only one that will see them. And I'm like, but why? And there's certain people that say, no, I'm not going to see it. Pediatrics, don't even put it on my schedule. I will cancel that case or I'll cancel that person. So there are certain areas and niches that you're going to feel more comfortable with and that you're not going to feel comfortable with. I had a partner of ours that was doing Da Vinci's and she said, I go home at night freaking out. I'm like, are they going to bleed? Are they okay? Did I get a ureter? What's going on? She's like, it was too much stress. I stopped doing it. So when you get into medicine, you're going to see that your pathway is your own pathway. That's why I don't feel giving you my pathway is the right one for you guys. Now, I would be more than willing to sit down with any of you guys and help you on your pathway, but it's going to be totally different than the person sitting next to you, than mine, than hers, okay? So your pathway is your own, and you're going to make mistakes, hopefully not as many, but you're going to make mistakes along the way, and that's going to make you stronger and make you realize, yeah, I didn't want to do that. You know, I test things all the time. I see clinic patients all day long. I thought, you know what, I'll do my lunch at 11 so that I can see patients from noon on. And I'll get them in, they'll be happy it's lunch, you know, they can see me over their lunch hour. I come in, I'm like, why is there only 6 patients on my clinic schedule in the morning? Well, you take lunch at 11. Oh, I did not like that. You know, then I all of a sudden saw 20 patients in the, you know, afternoon. And I felt like I was going crazy. You've got to try things, attempt them, see if it works for you. If it doesn't, that's okay, change it. I said, no, we're not doing that anymore, let's change it, okay? So take risk, take the ability, change it. You know, it's okay to think through it, but sometimes you think yourself out of stuff. Sometimes it's just better to jump in, see if it works. If it does, great. It's not gonna hurt you, okay? If you're gonna jump out of an airplane, please wear a parachute, all right? But if it's not gonna hurt you, it's okay to try, okay? Da Vinci, I love the Da Vinci. I do usually about one hysterectomy a week with the Da Vinci. It's very much changed the way we do things. Obviously for us in obstetrics and gynecology, you know, we come out with information because it does increase the price of medicine, and I'm very cost effective and try to be very conscientious of that. And with the fact that you're supposed to start with a vaginal hysterectomy, if that doesn't work, laparoscopic, if that doesn't work, do an open. Okay, there's only certain things you can do certain ways. You know, if the uterus has multiple fibroids, which are, does everyone know what a fibroid is? Okay, a fibroid is basically your uterus is a smooth muscle. It's a big, one of those muscle cells is continuing to generate and makes a big ball-like, a whirl-like pattern is what it's called, and it's on the uterus. If you have a 20-week size uterus, you're not going to be removing it through the vagina, okay? Just not going to happen. So there's certain indications for certain surgeries, and that's why us as surgeons have to do it. When people come into my office, they say, "You're going to use the Da Vinci, right?" I'm like, "Yeah." And they say, "So it just does it all itself?" No, that's not how it works. You know, people just think they come in, they lay down, and the Da Vinci just operates. Just does it. That's not what happens, you know. And a lot of people forget that there's a lot of information that we have to use to come up with who does get a Da Vinci, who doesn't, what technology we need to use, how we change our technology, how to do proper suturing, do we need to change that, you know, all these different ideas. Do we keep the ovaries in, do we remove the ovaries, you know, all these different ideas that we as physicians have to go through and decide. Physicians make those decisions, the Da Vinci just assists us in the operating room. If any of you guys want to see this, you know, my husband does prostates, I do hysterectomies. Sometimes it's harder to get into the hospital setting, but you know, if you want to, we can try. This is the other thing. Has anyone heard of Dr. Watson? Yeah, how many of you guys know him as a Jeopardy winner? Yeah, that's all he's known for right now. But actually, he's going to change and revolutionize internal medicine because physicians have basically put in all these algorithms and again, who put them in? Physicians, right? Using our mental capacity, physicians put it in, they came up with all the sort of algorithms, they made this computer system and it goes through these algorithms and comes up with a diagnosis or decision, okay? So you're gonna see probably a lot more of these Watsons around and helping. They're at different clinics right now using beta or prototypes. They're not really on the mainstream, but I'm just trying to show the difference between in the OR and in the clinic. You're seeing technology seep in all areas, okay? So what this does is basically you can put in the information and he'll come up with a diagnosis, okay? You guys have heard about that before Jeopardy? Or only with Jeopardy? Jeopardy, yeah. Future oath, I think you were gonna have to take into consideration other things. Why the future oath is because I think technology is changing. How many of you guys knew about cell-free DNA? How many of you guys know what cell-free DNA is? How many of you guys know genetic testing? Okay, cell-free DNA is a type of genetic testing, okay? So we use it all the time in our technology in our daily life. That cell-free DNA, I didn't know about it because it wasn't invented when I was in residency or medical school. But now we have it, we offer it to our patients multiple different ways. Now that we have the genome, the DNA, all of that stuff kind of figured out, now we have to talk to our patient, do you want to know all that before the baby's born? Do you want to know that your baby is going to have these diseases and by age 40 they're going to die? Or would you rather just let that baby live and enjoy life, not having this thing hang over them? It's kind of hard to make a decision, and patients always come to me and say, what would you do? You know, you have to give them all the information, but you can't. Personally, I don't feel I can say this is what you do or this is what you do, because if they do something and they're unhappy with that decision, they're going to come back and not be happy with you. So I would say it's a personal decision. You've got to make that decision on your own. Okay. A lot of things you do as physicians is not going to be answering it directly for them, but helping guide them to their answer. Okay. So a couple of things that I think is pretty amazing. This is what we saw as physicians. this is the things we saw, immunizations, you know, all these different changes that have occurred. Crazy, amazing things. 25 years added to the life expectancy. That's what we saw. This is what we grew up with. What are you guys gonna see? I don't know. This is some things I came up with. I hope you see even more. I can't dream it, but you guys can, okay? And that's what I wanna leave you guys with. Open your mind, be out there, dream, do whatever you wanna do in medicine. Your road is your own. And we can help you as a mentor, help facilitate that, but your road is your own. And what you glean from it is gonna be what you give into it, okay? So, that's it.